Sleep apnea does not automatically end your driving career. That is one of the biggest misconceptions I run into with CDL drivers. The real issue is not whether you have it, it is whether you are managing it. Here is how the FMCSA looks at this. There is no single rule that says sleep apnea equals automatic disqualification. What medical examiners are required to evaluate is whether your condition could interfere with your ability to safely operate a commercial motor vehicle. Untreated sleep apnea is a safety concern because it causes excessive daytime sleepiness and impaired alertness behind the wheel. Treated, well-documented sleep apnea is a very different conversation. During your DOT physical, the examiner is going to look at a few things: body mass index, neck circumference, blood pressure, and whether you have reported symptoms like heavy snoring, waking up unrefreshed, or struggling to stay focused during the day. They will also ask directly whether you have ever had a sleep study or been diagnosed with a sleep disorder. Answer honestly. Trying to hide a known diagnosis can result in disqualification, and if an accident ever happens, that concealment becomes a serious liability. If an examiner suspects undiagnosed sleep apnea, they can require a sleep study before they issue your medical certificate. Being upfront about your history is always the smarter play. Now, if you are already on CPAP or BiPAP therapy and you are using it consistently, you have real leverage here. Most CPAP machines generate compliance data, hours of use per night, how well the device is controlling apnea events. Bring that data to your exam. Bring a letter from your sleep specialist confirming your diagnosis and treatment plan. Bring your full medication list. Bring your original sleep study results if you have them. The more organized you are, the smoother this goes. One thing drivers do not always expect: if you are cleared for driving with sleep apnea, you might receive a medical certificate shorter than the standard 2-year period. Maybe 1 year, maybe less. That is not a penalty. It is the examiner doing their job, making sure your treatment stays on track. As you build a consistent record of compliance, certification periods can return to normal. And one more thing worth knowing: not every clinic can perform a DOT physical. Only examiners listed on the FMCSA National Registry of Certified Medical Examiners are authorized to issue medical certificates. If you are in the Central Valley, Modesto.com is operated by a board-certified family nurse practitioner with experience helping drivers navigate complex health conditions like this one. The practical takeaway: before your next DOT physical, pull your CPAP compliance report, schedule a follow-up with your sleep specialist, and walk in with your documentation ready. Preparation is what separates a deferred certification from a clean pass.